So I'm Karen McGowan, Head of Nursing Quality and Patient Safety in the Nursing Quality Directorate. Since April last year, I've kind of led on testing. Going back to last year, when we were sent home from work, we very quickly had to establish a work programme to support access to testing, and it happened overnight and very, very quickly. It was very different then to how it is now, and there was very strict criteria. So folks would only get tested if they had key symptoms within certain timescales. But that has changed over time. And what we had to develop very, very quickly was a robust booking process, not dissimilar to a production line. So we had identified roles, we had regular stop moments to reset processes when we had blocks or we had a build-up of calls. And in order to do that, we had the most magnificent partnership working. We couldn't have done it without the staff within the Nursing and Quality Directorate, but also the other directorates and the CCGs. As testing progressed, we continued to work with all our system partners, particularly CCU, police, fire, inevitably our health providers, but also the local authorities. We've come to develop really, really close relationships with the local authority partners who we may never have worked with before. And that's testing activities associated with managing outbreaks and also ongoing surveillance. Testing continues to be a priority. It's a key component to managing and containing COVID, not least because it helps to identify variants and the progress of the disease. But testing continues to develop. It goes from where we were tested, going off to a lab, to self-testing at home in 30 minutes, to actually self-testing in 10 minutes now. It really is progressing and continues to progress. And you can hear more from Nigel Williams about how he's set up the testing sites in Stoke and Stafford.
So just to introduce myself, I'm Nigel Williams. I'm a Clinical Quality Improvement Manager at the CCG, which means that I'm responsible for looking at the CCG commissioning structure for the quality and safety for our patients. So that's kind of what I do as my normal role. However, under COVID-19, I've been involved from the beginning in the testing sites, or testing cell, as we like to term it. This cell was really set up in response to the COVID-19 testing requirements for our key workers and then our public. So over the last 12 months, I was managing both sites in Stoke-on-Trent at Bet365 Stadium and at Burton-upon-Trent at the Burton Albion Stadium. So I kind of looked after both sites for testing of our key workers. And then as the national programme started to roll out to more national resources, I became more involved in helping to set up and to identify areas where we could get really good coverage across Staffordshire and Stoke-on-Trent for the testing requirements for COVID-19. So over the period, we've done a lot of work around streamlining our testing requirements, but then also looking at how we can support a lot of our providers of health and social care, from care homes through to our big NHS trusts, to our independent hospitals, on ensuring that they understand where the virus is and how the virus can be contained through a good, clear testing regime.